Greetings, Red Saree friends and organizers of this fabulous gala event. First of all, I'm extremely grateful to Dr. Sadayappan for giving me this platform to talk about a legislation that will help so many of us and our families. Not long ago, I had the honor to spend the year of 2018 in the office of Congresswoman Urmila as a Science and Technology Policy Fellow sponsored by the American Society of Mechanical Engineers. And among my responsibilities was a heart health bill related to South Asians. The South Asian Heart Health Bill had been drafted and introduced in the House in 2017, and my task in 2018 was to make the case for it by building support for it from heart health organizations and additional heart health organizations and additional House members, both Democrat and Republican. We made great progress, but with the elections coming up that November, the members must necessarily focus on the elections if they are to have the opportunity to work on their bills in the next Congress when the bill process starts over. Recall that in 2018, the Republicans had the majority of the House and the Senate. In the 2019 elections, the Democrats won the majority in the House. The majority party has some advantage in the process for bills introduced by members of the majority party. So in the Congress term that started in 2019, the bill was introduced again in June 2019, and Congress members and organizations that supported it in the previous Congress readily supported it again. The bill was taken up by committee for markup and amendment and was sent to the House for a floor vote in September 2020. The House passed it by a voice vote. The bill proposal contains two parts. The first part proposes heart health promotion grants and authorizes the Secretary of Health and Human Services to award heart health promotion grants to states for heart health awareness initiatives, educational materials, and training workshops for communities disproportionately affected by heart disease, and to conduct or support research regarding cardiovascular disease, type 2 diabetes, and related ailments among at-risk populations, including South Asian populations. $1 million is authorized for such grants in each of 5 fiscal years, 2021 through 2025. And an annual report must be submitted to Congress to report on outreach efforts and data relating to heart disease in communities disproportionately affected by heart disease, such as South Asian communities in the US. The second part of the bill proposes heart health research and states that the Secretary of Health and Human Services may also establish research catalogs for existing heart health research and treatment options. And another $1 million is authorized for this part of the bill for each of 5 fiscal years, 2021 through 2025. We had actually asked Congresswoman Jaipal to provide us a video for today's event. Unfortunately, she was unable to do so, but I do have a video of the Congresswoman presenting the bill to the House floor on the day of the vote. Before we play the video, let me provide some background details. Ben Narala was the legislative director in the Congresswoman's office and my mentor during my fellowship. He was a superb mentor, very knowledgeable about processes, and very well connected. The 115th Congress started in January of 2017, and in February 2017, Ben's parents, while traveling in India, Ben's mother suffered a heart attack and sadly succumbed to it in a matter of days. This was obviously very traumatic for Ben, and I think this is what led to this bill. Similarly, it came to be amongst my tasks, probably because of my own family experience, the untimely and sudden passing of my dear husband from type 2 diabetes and its consequent cardiovascular and neurovascular disease. So here is a video clip.
To yield such time as she may consume to the gentlewoman from Washington, the sponsor of the bill.
The gentlewoman from Washington is recognized.
Thank you, Madam Speaker, and thank you so much, Mr. Chairman, for your leadership, and to the ranking member for your excellent comments. I understand the concerns, and I would just say that as the first South Asian American woman ever elected to the U.S. House of Representatives, I'm so proud to see this important bill come to the floor, and I want to thank my colleague, Representative Joe Wilson, for his help and support of this important bipartisan bill. South Asians are the second fastest growing minority group in the United States, and yet this group is 4 times more at risk of developing heart disease than the general population and have the highest prevalence of type 2 diabetes. The research and understanding of why we are so prone to heart disease is limited, while the devastating impact on our families is only increasing. In fact, the story of this bill, as much legislation happens, began when my former Deputy Chief of Staff, Ven Narala, unexpectedly lost his mother to heart disease. Wanting to understand why this happened, we found that this was not just an isolated incident, but an alarming trend that had received far too little attention. The South Asian Heart Health Bill will fund the creation of culturally appropriate materials, engagement with community groups working to promote South Asian heart health, and create an information clearinghouse about South Asian heart health. The bill also funds grants for the CDC and NIH to conduct research on the impact of heart disease on South Asians in the United States. The bill has been endorsed by an incredible number of medical organizations, including the American College of Cardiology, the American Heart Association, Women Heart, South Asian Public Health Association, and many, many more. COVID-19 has taught us the value of preventing underlying health conditions and addressing health inequities afflicting communities of color. The South Asian Heart Health Bill is a significant step in raising the alarm, reversing the trend of heart disease in our communities, and saying to South Asian American communities across the country, we see you here in Congress and we are ready to help. Thank you, Madam Speaker. I yield back.
The gentleman from New Jersey.
The bill has passed the House and has gone to the Senate, where it has been assigned to a Senate committee. Again, since this occurred on the last day of September of 2020, the senators were by then again focused on their election or re-election. For a bill to become a law, it must pass in both chambers of Congress, the House and the Senate, and then it goes to the President for approval and signature to become law. Because of the election cycle of Congress, the full House and 1/3 of the Senate is up for election every 2 years. So a bill essentially has 2 years for it to be passed, because every 2 years, a new Congress begins, and the House bill process starts all over again. So the bill must be reintroduced in the next Congress and undergo the same process, hopefully at a faster pace in 2021, and get it to the Senate in 2021 itself, so that the Senate has ample time to work on it much before the 2022 elections. How can we help? One big way we can help is to ask our Ohio senators to introduce a companion Senate bill so that the House and the Senate consider the bill simultaneously instead of sequentially to expedite the overall process. And I will be willing to help in any way I can towards this. In any case, we should take pride that an issue so foundational to Red Saree is recognized at least in one chamber of the Congress, and we hope that the Senate can also approve this legislation so that the new president can receive it promptly and hopefully sign it into law. Thereafter, the bill's proposals can be put into action. This will be an enormous victory for us. I will close with the observation that science provides data that guides policy, and policy supports the operation of scientific research and implementation of research outcomes. But how much support is given and to whom it is given is rooted in policy and politics. As you heard in the video clip that I shared with you, it was scientific research and data that urged the need for this bill. And we believe that science will indeed shape national policy again under the new leadership in the White House Oval Office. And once again, I thank you for this opportunity to share with you details of the South Asian Heart Health Research and Awareness Act. Let us bring all of our creative resources together to ensure it becomes